Good morning. This is Dr. Tarek with some more questions about phlebotomy. Let us begin. A phlebotomist has a requisition to draw blood on a patient who has severe Down syndrome. Which of the following steps should the phlebotomist take? Explain the procedure to the patient in simple words, then proceed with venipuncture. Speak with the patient guardian before performing the venipuncture. Draw the blood without explanation. Ask the patient guardian to hold him still during the procedure. The answer is B. Speak with the patient guardian before performing the venipuncture. How long after a patient has taken an oral medication should blood be drawn for peak level of the medication? 3 hours, 2 hours, 5 hours, 3.5 hours. The answer is B. 2 hours. How should bilirubin specimen be kept after collection? At 39 degrees centigrade, away from light, close to the light, at body temperature. The answer is B. Away from light. Where should ammonia specimen be kept after collection? In an ice water slurry, at body temperature, at 39 degrees centigrade, all of the above. The answer is A. In an ice water slurry. A phlebotomist is drawing blood from the uh, and observe red spots. Which of the following is an appropriate action for a phlebotomist to take? A phlebotomist is drawing blood from and observe red spots. Which of the following is an appropriate action for a phlebotomist to take? The options are: stop the draw immediately, apply ice to the site, apply pressure after collecting the specimen, release the tourniquet immediately. The answer is C. Apply pressure after collecting the specimen. Which of the following procedural steps for a finger stick should the phlebotomist do first? Clean the site, select the appropriate part of the third and fourth finger, position the blade of the lancet across the lines of the fingertip, confirm identity of the patient. The answer is D. Confirm identity of the patient. Besides gloves, which of the following PPE should a phlebotomist wear when drawing on a patient with pneumonia? Face mask, gown, N95 respirator, shoe covers. The answer is A. Face masks. Which of the following is appropriate to use when collecting for a chemistry test that requires serum? SST, EDITA, PST, SPS. The answer is A. SST. Phlebotomists often have many duties and tasks. Which of the following is one of the primary duties? Sample processing, sample accession, collection venous blood, collecting arterial blood. The answer is C. Collecting venous blood is the main duty of the phlebotomist. The phlebotomist notice that a blood culture tube is cracked. What step should a phlebotomist take? Send tube to the lab as is. Discard the tube in a gloves. Discard the tube in a sharp container. Dispose the tube in the trash. The answer is C. Discard the tube in a sharp container. Identification of a specimen. How do we do identification of a specimen? The accession number, time of arrival, color of the tube, none of the above. The answer is A. We identify the specimen by accession number. Technician should follow contact precautions when interacting with a patient who has scabies. Wearing gloves, and gown, wearing N95, wearing head cap, all of the above. The answer is A. Wearing gloves and gown while interacting with a patient who has scabies. How should gold agglutinin specimen be kept after collection? In ice water, in cold water, warm, at 35 degrees centigrade, all are wrong. The answer is B. The specimen for cold agglutinin, the cold agglutinin specimen should be kept warm. When collecting for a potassium test, take which tube? Green color top tube, red color top tube, yellow color top tube. The answer is A. Green color top tube. Which tube is used to perform a complete blood count? Grey top, lavender top, green top, marble top. The answer is B. A lavender top tube is used to count CBC. Which of the following refers to the process of cleaning up of blood specimen spill on the counter? Neutralization, containment, disinfection, sterilization. The answer is B. Disinfection. When the patient refuses to have blood drawn, the phlebotomist should do all the following except contact the patient nurse or physician, return the requisition to the lab, force the patient to have blood drawn, try to convince the patient to have blood drawn. The answer is C. Force the patient to have blood drawn. We should never do that. So this is all for today. See you next time with some more questions. Please subscribe my channel and like my videos. Bye.